Hi, my name's Travis Mason. I'm the founder and CEO of Random Potential. Random Potential are a technology company focused on bringing artificial intelligence to bear on problems in the real world. We focus on natural language understanding and conversational user interfaces and text analytics. We're a small team but have a combined 75 years in customer contact technology and operations. In starting Random Potential, I brought together specialists in the field of business analytics and customer contact, along with my background in communications technology, to develop a health-focused solution to patient contact and communication. We're all passionate about the health sector and using our technology to improve patient and clinician outcomes. So for this challenge, our proposal is to use a natural language artificial intelligence to elicit patient response to the questions you need to ask. We're proposing to do PRM collection and analysis via conversational AI, analysing both the quantitative as well as the qualitative responses given to provide better insight into patient health overall. So what is conversational AI? Well, let's start with a textbook style definition. A conversational AI is a machine that can listen to a person, understand the intent of the statement or question, and provide an appropriate response in the context of the conversation and personal circumstances. In other terms, it's a chatbot. That word's used for everything from simple autoresponders on websites. They get nothing done. Things like on car sites where you see the little, can we help you buy your Ford or whatever it is you're looking to buy or whatever it is that you're looking at on the website at the time. So everywhere from there to the most sophisticated artificial intelligence, natural language constructs that exist today, things like Watson's ability to win at Jeopardy, for example. So why do we think conversational AI is the right way to go? Well, based on all the academic research that we've gone through, as well as what we've seen in practice, this method of communication is far more effective than forms and pro forma responses and even apps for eliciting what people might really think and might not necessarily want to say to a real person. We believe that using a chatbot via the patient's channel of choice and SMS, social media, the website, will get better response rates, will elicit more honest information and help both patients and clinicians achieve the best possible outcomes. So what would what we're proposing look like? Well, simply put, and as you can see on the left there, it looks like someone is texting you and asking how you're going. It really is, from the patient's perspective, as simple as that. We ask the PRM questions that you would like to elicit via natural language and using familiar and high response rate media, Facebook, Instagram, SMS, as we mentioned before. This mock-up, we've only mocked up a simple example here, as we'd like to talk more about the types of data you're trying to collect without painting a picture on it previously, and we very much want you to think outside the box of the traditional form-style data collection that I'm sure you've been thinking of. Having said that, we can keep it simple. We can do questions like, please rate your care on a scale from 1 to 5. You might have noticed the last response from the patient to the question, have you had any issues over the last week, that you should mention. And they've responded, I had trouble moving my leg last Thursday, but it's okay now. In a form response, all you're going to get is a yes or no response to that. Have you had any issues? And they're going to assess in their heads whether or not they could bother to say yes and have to deal with the ramifications thereof. You might get some free-form texts saying, yeah, my leg was a bit sore. But that needs to be looked at a doctor or somebody who's reviewing these forms before anything can be done about it. Using the AI, we can identify that it's an issue. We can respond immediately using a number of options to contact patients, to give them information about what they should be doing, to contact doctors or other clinicians directly on whatever channel we use. We can send them an email, ring them, send them a chat message, send them a text. This immediacy of issue identification is one of the strengths of the solution. We believe one that will really show that Western Health cares for their patients as much more than a tick box on a form. So who uses them today? Well, there's lots of very, very large companies and some very successful and some famously unsuccessful chatbots in use today by some of Australia and the world's biggest customer-focused organisations. Those that work well have thought long and hard about the type of experience they want for their customers and have invested successfully in those solutions over time. Just a note here, these implementations that we've got up on the board weren't done by Random Potential, but a lot of the team have worked on a lot of these projects. So I hope you've learned a bit more about our proposal from watching this today, and then we can look forward to discussing our proposal more in the future. Thanks for watching.